I'm Stephen Bezruchka. I've spent 30 years trying to figure out why our health outcomes in the United States are so poor. What I found is that it has more to do with where you live and not how you live. I'm going to share with you what needs to be done so we live healthy lives like those in all the other rich countries. I used to believe my health was under my control, helped by medical care when needed. I exercised by climbing mountains, was a vegetarian for years, prided myself on my low cholesterol, went to medical school, and worked as a doctor in a variety of situations. These included setting up a community health project a week's walk from the road in Nepal, and organizing a remote district hospital in the country as a teaching hospital for Nepali doctors whom I supervised. I worked as an emergency doctor in the United States for 30 years. Eventually, I discovered that people in the U.S. did not live as long as those in many other countries, including all the other rich nations and some poorer ones. I wanted to know why this was so. My background includes a graduate degree in mathematics from Harvard University, a medical degree from Stanford, and a public health degree from Johns Hopkins, housing the world's largest such school. I came to see that making a population healthy was a different task than telling people what to do about their personal health. My last 30 years have been spent in getting others to consider what I've learned. I've written scientific articles, taught students from grade 6 to graduate school, wrote books, did TEDx talks, and used as many communication resources as I could. This series on social media is my foray into that realm. Please join me so we can share understanding. You don't have to believe that what I say is true, but if the health of your children and your grandchildren matters to you, then at least consider the ideas presented here. The task ahead is to recognize that people in the U.S. don't live such long lives. Simply, if you're dead, you can't be healthy. While working as an emergency doctor, occasionally somebody would die. I then filled out a death certificate. That document was later linked with that person's birth certificate, allowing mortality rates to be calculated. Death is hard to fake, so to me, mortality rates are the most important health indicators. The best summary mortality indicator is life expectancy. Consider it as a measure of the average length of life if mortality rates stayed the same from year to year. These numbers are calculated for all rich nations, and there are good estimates for the others. Using life expectancy will come to question many beliefs about what produces health. This YouTube channel, Healing America, presents the science of population health, namely what makes a society healthy. Those who live in healthier societies will have better health than those who don't, irrespective of many personal behaviors. This is a challenging concept for many who've grown up believing that what you do matters most. The Olympics are a major event that happen every 2 years. Medals are awarded to the top finishers in the various competitions. Imagine if we had health Olympics, in which countries to compete to see who was the healthiest. Let the race be how long people live, and the clock is life expectancy. How do you think the United States would fare? With an audience, typically Americans, I asked them to raise their hand if the U.S. would win the gold medal, the silver, the bronze, be in the top 5 nations, 6 to 10, and so on. I used this Health Olympics poll. I tell them that the United States spends half of the world's healthcare bill, almost $5 trillion, which represents 1/6 of the entire U.S. economy. In a typical American audience, hands go up for our being a top finisher. This is true for medical students and their teachers, doctors, and others. Where would you place the United States in this competition? I then present the actual outcomes for the top 45 nations today. This is from 2022. Surprised? Ahead of us with longer lives are all the other rich nations and quite a few not so rich. The longest lived country is Japan and has been for nearly 50 years. The United States is tied with Cuba at 44th. People in all the other rich nations live longer lives, even some poorer ones like Slovenia, Chile, Thailand, and China. It wasn't always like this. Back in the 1950s, America was in the top 10. In 1970, when I started Stanford Medical School, we stood 17th. In 1992, when I began studying public health, we were 22nd. What this means is we are falling behind in achieving good health. I used to believe we'd bottomed out in the 20s and would not continue to drop. How wrong I was. You might not believe what I'm telling you. If any of this were true, surely we would already know about it and our government would be working to fix it. We have a blind spot. There are many reasons, among them the belief that the United States is the best at everything. Another is the individualist mentality here, namely, what matters is what you do yourself. We are constantly bombarded with health-related marketing. You eat healthy choice brand foods, exercise at fitness studios, pursue happiness with a vengeance, and if anything is wrong, there's medical care which you can access at urgent care centers or the emergency department of a hospital where they have to see you whether or not you have medical insurance. And don't get me started on the wellness industry. Trying to get people to recognize these are dead ends is the challenge. It is un-American to even consider it. The National Academy of Sciences was established in 1863 by Congress and President Lincoln. The National Academy of Medicine appeared under that umbrella in 1970, providing independent, objective analysis and advice to the nation to solve complex problems and inform public policy decisions. In 2013, they published U.S. Health in International Perspective, Shorter Lives, Poorer Health. The title presents the essential concept. The text backs up what we have discussed so far. You can download this free from a link in the description. Right out of the gate on page 3, they write, quote, Americans with healthy behaviors, or those who are white, insured, college-educated, or in upper-income groups, appear to be in worse health than similar groups in comparison countries, end of quote. This is perhaps the toughest concept for Americans to grasp. None of us can escape having poorer health outcomes because we live here. Our Central Intelligence Agency, in its World Rankings website, describes life expectancy at birth is also a measure of overall quality of life in a country and summarizes the mortality at all ages, end of quote. And then lists the United States at 49th, estimated for 2024. It is clearly not a secret. Internet searches for U.S. is the world's healthiest nation support what has been presented so far. My goal is to provide you a simple understanding of our health. While the U.S. life expectancy number is occasionally presented in news reports and then it lags behind other nations, what is missing from these reports is the significance of the gap, which today is around 7 years. Our 3 leading disease killers for 2022 are heart disease, cancer, and unintentional injuries. Together, they constitute almost half of all deaths. If we were to eradicate these, we would almost close the gap. Such carnage shows that the U.S. clearly is not very healthy. The 2013 Shorter Lives, Poorer Health report laid out steps to improve our health, including creating awareness of these mortal facts and learning from other countries on how they achieve better health. We know enough about how to make a society healthy. We just need policies in place that use that knowledge. What we lack today is enough of us being aware of our poor health and having the will to do what we know works. So many other nations have better health than we do. We must learn from them. The Greek philosopher Plato wrote almost 2,500 years ago about inequality. He argued that for a healthy society, the ratio in wealth between the richest and poorest should be no more than 4-1. That is, the richest should have no more than 4 times the wealth of the poorest. Today, that ratio in the United States is more like 1,000,000,000,000 to 1, and it is a root cause of our dysfunctional society and lack of the best health outcomes. The first studies investigating the impact of inequality on health appeared in 1979, followed by many explorations of the topic. Today, they number over 500, and the effect is causal. More income or wealth inequality causes worse health. Wilkinson and Pickett link an index of health and social problems among the 23 richest nations with income inequality. Their book, Spirit Level, is the best read on this material. Besides life expectancy, the index includes infant mortality, homicides, mental illness, math and literacy outcomes, imprisonment, teenage births, trust, obesity, and social mobility. It should be no surprise that the United States does the worst in outcomes and has the highest inequality, as depicted in this graph from the Spirit Level. With a large gap between the rich and poor, we feel more stress. Even the richest among us feel they are not rich enough. A junk bond trader who finally made the Forbes billionaires list was being congratulated on his accomplishment. His response, "But I'm at the bottom." In a hierarchical society, typified by a large gap between rich and the poor, if you're on the top, you have power, can dominate, and coerce others. If you are towards the bottom, you resign yourself to the situation, feel resentment, but hide it, as you have to submit to those above. Compare these with feelings in an egalitarian society: support, friendship, cooperation, and sociability. They sound much healthier. This helps explain why people in the United States experience so much stress. Ranking countries by stress puts America near the top. Feeling stressed all the time is not healthy. Maybe you can relate. We'll get into that later. In addition to stress is the feeling of helplessness. With more money comes more political and societal power. The rich put their children in private schools and use legacy means to put them in prestigious universities. They live in gated communities with enhanced security, have chauffeurs and private jets, concierge doctors at their beck and call, among other extravagances. They avoid paying taxes that would provide basic services to others. The richest 400 families in the U.S. pay the lowest rate of income tax. They've gained the system to their favor. With the 2025 tax cuts, the situation becomes even more obscene. A study by the Rand Corporation found that from 1975 to 2023, some $79 trillion has been transferred from the bottom 90% of Americans to the top 1%. A pile of freshly minted $100 bills stacked tightly to that amount would reach a quarter of the way to the moon. This is not good for our health. Other healthier nations have more progressive tax systems where taxes rise along with income. People there have less stress and better health. Living where there is high inequality is bad for your health. My book, Inequality Kills Us All, has much on this topic. As a kid, you might have considered me as a loner. I taught myself calculus around age 13 and grappled with concepts of nuclear physics from a graduate school text. Once I started university and found others who shared my interests, my newly found social network was inseparable from my solitary pursuits. Those relationships remain a steadfast source of support today. It took me a long time to realize how important they are for being healthy. Ancient Eastern philosophies, like Buddhism and Taoism, point out the need for interconnectedness among individuals and social harmony for good health. Being alone worsens health. Social support is better at averting death than stopping smoking or drinking, exercising, taking medicines for high blood pressure, and more. A seminal 1979 study in Northern California found social isolation led to a doubling or tripling of mortality. Many reports followed, all reinforcing the ancient wisdom. Loneliness is not good for you. Solitude is related to income inequality via many mechanisms. With a bigger gap between rich and poor, there is less civic participation. People do things by themselves. It's the title of Harvard sociologist Robert Putnam's book, Bowling Alone. He highlighted the importance of social capital and connections with others we can call upon for help, and the social networks that foster trust, cooperation, and belonging. Social media has brought about a loneliness epidemic, with more and more people feeling isolated with diminished social capital. This impacts our younger generations the most. You see people on their devices almost everywhere, including in men's bathrooms or on bicycles. There are calls to ban smartphones in schools as it disturbs the educational process. Venting on social media involves sharing emotions, frustrations, or grievances publicly, often with malicious intent. While it may seem a way to seemingly relieve stress and connect with others, there are major downsides, such as creating negativity, potentially damaging relationships, and impacting mental health. Excessive social media use is linked to increased anxiety, depression, and sleep disturbances. Some consider smartphones to be electronic child molesters. The addictive nature of social media and the curated content can lead to negative social comparison, cyberbullying, and a distorted sense of reality. Major depression in young girls has become common in the U.S., perhaps because of beauty comparisons made amongst them. Jonathan Haidt's bestseller, The Anxious Generation, attests to the impact on Gen Z, a generation who always had the internet and now spend less and less time with friends, addicted to their devices. What will happen to the social forces at work in our society that impact our health, and how can we tame them? An unresolved dilemma. Interacting with friends and family face-to-face improves health. Being alone together on the web does not. The United States spends nearly $5 trillion on health care, a sixth of our total economy, and much more than any other nation, yet we are still not healthy. Is medical care not having an impact, or are we just doing it wrong? Medical care treats illness and injury, but lack of medical care does not cause illness and injury. We talk of accessing health, paying for health, getting health, insuring health. When we mean accessing health care, paying for health care, getting health care, and insuring health care, our language limits understanding. Surveys have asked people in the U.S. and 7 other countries to rank these 10 factors that impact health from the most important to least. How would you rank them? What would be the most important and the least when it comes to your health? People in 7 of the 10 nations, including the U.S., ranked healthcare first, and all ranked politics last. Only China ranked income and wealth and education more important than healthcare. When we looked at how Americans rank these factors, healthcare and politics are far from the reality of their actual impact as they could be. I became a medical doctor believing that it was the most worthwhile vocation possible. I also experienced both the benefits of medical care and the harm it could inflict. In 1958, when I was 15, I had a patch of acne below my right ear. My mother took me to a dermatologist who did weekly radiation treatments to that part of my face. It worked and I was delighted. 17 years later, a lump appeared that turned out to be a lymph gland cancer, a result of the acne treatment that I have been battling ever since. But I'm still alive at 82. Medical care can help, but it can also do harm. That is why doctors take the Hippocratic Oath, primum non nocere, or first do no harm. We will talk more on medical harm in another video. Medical care treats mostly cells and organs in the body. We take aspirin to treat platelets, statins to treat liver cells, antidepressants to treat neurons in your brain, and drugs like Viagra to, If you have a heart attack, it's usually caused by a blockage in an artery feeding the heart muscle. And a cardiologist can thread a Roter device into the artery to open up the flow. This time, medical care treats a specific organ. If an unhoused person came into my emergency department complaining of being weak and dizzy, I had to decide if hospital admission was necessary. I could spend thousands of dollars on tests and typically couldn't justify admission and had to prescribe something they couldn't afford. If medical care treated the whole person, our healthcare system would find them a home, companions, and meaningful work. Research from Stanford Medical School, my alma mater, reviewed different estimates on the effectiveness of U.S. medical care in keeping people alive. At best, it could only avert 10% of deaths. That left 90% impacted by other factors, like income inequality and social factors we've already discussed. The Commonwealth Fund compares healthcare performance among rich countries and ranks the U.S. last, despite spending the most. Other scientific studies show the U.S. performing nowhere near the top. Healthcare has serious limits to its effects on life expectancy. Abandoning the idea that medical care is the key to a long life won't be easy, considering we've been told this all our lives. When asked what needs to be done to improve U.S. health, most people say focus on prevention. Primary prevention means not having the disease to worry about, such as an immunization to prevent diphtheria or measles. Secondary prevention is screening to detect disease early, hoping treatment will avert bad outcomes, mammograms, colonoscopies. Tertiary prevention seeks to minimize suffering among those with the disease, exercise for type 2 diabetes, high blood pressure medicines. Providing basic sanitation has been the most influential primary prevention strategy in the 20th century. Keeping fecal waste out of food and water, along with provision of clean water, has saved countless lives. It is taken for granted, except in tragic stories like Flint, Michigan, where the water coming out of their faucet is contaminated, or where the meat you buy in the grocery store contains harmful bacteria that can kill you. Believe it or not, millions of Americans still lack basic modern plumbing. There's room for improvement here. Better standards of living leads to better health. Provide everyone with basic necessities such as food, clean water, and adequate shelter. This is a really low bar that has a huge impact on health. America has increasing numbers of unhoused folk who don't know where or when their next meal will be. Our higher mortality is rooted in this malignant neglect. In the United States today, there's increasing distrust of scientific evidence. Our educational system has turned away from teaching critical thinking skills. Among rich nations, Americans have the lowest rate of believing in evolution. A substantial portion believes the sun orbits the earth. Many other examples indicate we don't rely on science to make healthy societal decisions. The anti-vaxxing movement today has produced a resurgence of measles. Today's focus on sick individuals distracts us from understanding sick populations. We care more about who is sick rather than why they're sick. This is a concept explored by the very influential British epidemiologist Geoffrey Rose. In his seminal book, The Strategy of Preventive Medicine, Rose concludes with this paragraph, quote, "The primary determinants of disease are mainly economic and social, and therefore its remedies must also be economic and social. Medicine and politics cannot and should not be kept apart." End of quote. Medicine here, in the British sense, refers to the broader issues of health. People have been led to believe that politics don't impact their health, but the opposite is true. Our longest lived state is Hawaii and has been for decades. Its life expectancy is below that of most other rich nations, but it is where Americans live the longest and enjoy the best health. Every U.S. state has a Department of Health responsible for public health issues. What does Hawaii's Department of Health say about being healthy? Hawaii's Department of Health produced a report on chronic diseases to educate its people and suggest ways of improving these outcomes. On page 2 is a metaphorical graphic of a mountainside with a waterfall pouring into a river flowing into the ocean. If you've been to Hawaii, you know why they chose this image. Makai means to the water. In the ocean are downstream effects, or many of the chronic diseases that you either are suffering from now or will. They include heart disease, cancers, diabetes, and so on. On the shore, on one side of the river, are risk factors: smoking, physical inactivity, obesity. Behaviors we're constantly urged to change to be healthier. On the other side of the river, you see access to health care. Like the risk factors, these are far downstream. Hawaii's health department recognizes how limited health care is. America spends a huge amount on health care, and we aren't very healthy. Upstream is a huge waterfall. On both sides of the waterfall are what are now called the social determinants of health: racism, poverty, pollution, occupation, education, and income, among others. Addressing these critical factors will be our greatest challenge to improving health. Climbing up a waterfall is a very apt metaphor. Above the waterfall, looking towards the sky, or mauka, are upstream root causes: socioeconomic conditions, and above that, political context and governance. Hawaii's Department of Health puts politics as the core determinant of a population's health. What is political context and governance, or politics, all about? Politics means having the power to decide who gets what, when, and how. Power in America is disproportionately vested in a single person, the President of the United States. Current political actions, increasing inequality, will raise mortality, leading to worse health and shorter lives. The U.S. healthcare industry prides itself on consisting of the most talented specialists and the most sophisticated medical technologies available today. But are we focusing too much on these resources that we may need at some point in our lives and ignoring the proven basic needs that can lead to healthier, longer, and more productive lives and could minimize the need for such costly resources? If you change the oil in your vehicle on a regular basis, you can greatly reduce the possibility of needing to replace the engine or transmission during the life of the vehicle. The impact on health of the entire medical care industry is modest. One part of it, primary care, is proven to impact health outcomes the most. Primary care refers to your visits to family doctors, pediatricians, general internists, and includes care and advice provided by nurse practitioners, physician assistants, and others. Many other countries focus their healthcare systems on primary care. When I practiced in Canada as a family doctor, the system allowed me to refer patients to specialists such as endocrinologists, surgeons, or gynecologists, but patients could not independently seek them out and send the bill to the government. In the United States, most doctors seek specialty training because it pays more and practitioners gain specific skills. The doctors have better financial outcomes as specialists, but the health outcomes are better when the system is organized around primary care. A good primary care system has one person that you see when necessary. They're nearby, have convenient hours and access, and they have time to spend with you. She or he should exhibit competency, be someone who cares for you rather than profits, and most importantly, you should have faith in them. These principles work for me when seeking medical care for my various ailments. Among U.S. counties where primary care services have declined, mortality has gone up, and where they have increased, we see improved health. But American primary care is dying, and this will not be good for the health of Americans. A country's strong primary care system lessens the impact of income inequality on health. America falls down on both factors, lacking a strong primary care system and having huge inequality. We don't have enough doctors to serve people in America, the lowest proportion among all rich countries. We have few medical schools. In fact, almost a quarter of U.S. physicians come from other countries, mostly poorer nations, which end up shouldering the cost of training doctors who then come to the U.S. to practice. That isn't fair. Previously, we discussed the structure of medical care in the U.S. as a problem. Now we understand why. Given the limited health benefits of medical care and the beneficial impacts of social factors on health, social spending really matters. This is spending on education, income support, transportation, environment, public safety, excluding prisons, and housing. More social spending leads to healthier lives. This country must refocus its priorities. Back in the 1950s, I received radiation treatments for acne. We no longer treat acne this way because of the harm it produces. In my case, lymph gland cancer. Medical care can help, but can also damage. That is why doctors take the Hippocratic Oath, primum non nocere, or first do no harm. The first comprehensive studies on medical harm appeared in 1991. Many studies since have all shown that such harm is common and often results in death. You'll find many stories like mine. Studies show when doctors go on strike, morticians have less work to do. This sounds ridiculous, but it's true. If medical care were considered a cause of death, it would be right up there behind heart disease and cancer. But no one put such a diagnosis on the medical chart. The term medical harm has been sanitized to patient safety or quality improvement, adverse events, and others, but harm remains a more accurate descriptor. Once you question how much harm there is, you'll be astounded by the evidence. The World Health Organization estimates that 1 in every 10 patients is harmed by healthcare, and more than 3 million such deaths occur worldwide each year, making medical care among the top 10 leading causes of death worldwide. Not a reassuring thought. Examples abound. Mistakes in given medicines are very common. Surgical errors happen frequently. My sister-in-law went in for elective surgery at the top-rated hospital in Washington State. Despite being seemingly healthy, she died on the operating table from an instrument malfunction. Surgical instruments are commonly left behind in the body after the surgery is completed. This X-ray shows a 13-inch piece of steel left behind in the abdomen of a patient at the same hospital. He complained of belly pain, but the doctors didn't take him seriously. The problem became evident when he tried to go through a metal detector. I could show you many other similar pictures. Other sources of medical harm come from healthcare-associated infections, wrong diagnoses, blood clots and pressure ulcers from being treated, and many others. In my class at Stanford Medical School in 1972, a professor began his lecture by saying, quote, "In 10 years' time, you'll find that half of what I am telling you is wrong. I just don't know which half," end of quote. Medical care is more of an art than a science. I do not advise against receiving medical care. I worked as a doctor for over 35 years, doing my best. I've also received medical care and continue to do so. But how to not be harmed is challenging. Radiation for acne was common in the 1950s. What kind of medical care practices we do now will we abandon in the future because they either don't work or cause harm? The crystal ball is cloudy. To navigate the healthcare system, ask questions, seek those who have your best interests at heart, and exhibit competence, however that is determined, and that you have faith in. The poet T.S. Eliot wrote, "In my beginning is my end." Conditions in the first 1,000 days after conception shape half of our health as adults. Healthier societies recognize that raising healthy children requires time and money. They support maternal care and early life in many ways. National policies of paid parental leave, along with low-cost childcare and free preschool, are ways other countries contribute to better health. Escaped slave and abolitionist Frederick Douglass said, "It is easier to build strong children than to repair broken men." America has a huge industry trying to repair broken men and women, albeit unsuccessfully. Stress in early life tells the fetus, while it is still in the womb, that it better mature its organs quickly, as it will likely be born early and have a low birth weight, which compromises adult health. It then must grow to reproduce and pay the price later in life with the chronic diseases most of us will suffer from: heart disease, diabetes, and many more. This womb with a view perspective helps explain America's high rates of preterm births and low birth weights. Like so many factors which impact our health, the situation is worse for African Americans and those among us who are poorer. We have more poverty, and especially more child poverty, than any other rich nation. Poverty in a country is the direct result of policy choices. We've made the rich ever richer, while our policies punish the rest of us, especially the poor. Being poor in the United States is not the result of personal failings, as so many believe. Poverty is inequality's twin. Many believe the United States is a meritocracy that rewards those who work hard and achieve. The rest of us are laggards. This is a myth designed to shift the blame for poverty to these so-called slackers. The United States began social spending with the New Deal in the 1930s and the War on Poverty in the 1960s. But as political winds have changed, we've ended welfare as we know it, beginning with the Clinton administration. Today, even small efforts to decrease poverty are being trashed. This does not bode well for our nation's health. We are born totally helpless and dependent on others for care. Your parents are responsible for that early period. Good parenting is largely shaped by the society in which those parents live. Caring for a small child or infant requires the parents to have time and resources available. Almost every country has a national policy providing paid time off for mothers. Only 2 populous nations do not. One of them is Papua New Guinea, north of Australia. The other, the United States. A few U.S. states have a paid leave program, most of which offer 12 weeks of paid leave. That is the least amount provided by other nations. Take Sweden as an example. There, you're required to take 444 days of paid leave at full pay, split between mother and father. Father has to take at least 13 weeks. The rest of the second year's leave is optional at 70% pay. In your child's third year, he or she can be placed in a free government-run daycare center. The daycare workers have an advanced degree in play, as that is what daycare is about, socializing the child. John Bowlby, a British psychiatrist studying orphans after the Second World War, found that to be raised successfully, the orphan fared best if there was mostly one pair of eyes around the infant. Humans are the only primates with whites in their eyes. Newborns don't have good vision, but they can see contrast and attach to a caregiver's eyes. Recall the eyes of your mother, assuming she was there for you in the first few years. As the child grows, it is comfortable exploring the outside world, knowing that there is a secure base, the mother figure, to return to. This secure attachment leads to good adult outcomes. Mortality among diabetics is lower among those securely attached as infants. Secure attachment in early life leads to better adult health. Unfortunately, the flip side of that is also true. Child abuse happens. The more adverse child experiences, or ACEs as they're called, the worse the health of those children. This includes shorter lives, more mental illness, substance misuse, among others. ACEs increase as income inequality grows. We will dive much deeper into ACEs later in this channel. To summarize, as we go from erection to resurrection, the first 1,000 days, ending on your second birthday, matter most for our adult health. Healthier nations have policies to support that period. Decreasing poverty has the greatest impact. If you've watched this far, you've discovered that our health here in the United States is just not that good. Looking at the most basic indicator, how long people live, measured by life expectancy, we need to improve. With health as an Olympic event, the race being how long people in that country lived, most Americans would rank the U.S. very high, typically in the top 5, at least the top 10 nations. In reality, in 2022, there were 43 countries where people lived longer lives, including all the other rich countries and quite a few not so rich. Our health was the same as Cuba's. the country we've been strangling for over 60 years. If we eradicated our 3 leading disease killers in 2022, we would be close to being the longest lived and thereby the healthiest nation. All it would take is eliminating deaths from heart disease, cancer, and unintentional injuries. The 2013 Institute of Medicine report, U.S. Health in International Perspective, Shorter Lives, Poorer Health, pointed out that this applies to all of us and recommended learning from healthier nations. Healthier nations have less economic inequality by a variety of means, including more fair taxation systems. In the U.S., the richest pay the least tax, and we have a huge wealth pump taking from us and surging to them ever more. Many social factors produce good health. Friends, family, and other sources of non-virtual support you can call on have a greater impact on our health than quitting smoking or changing other unhealthy personal behaviors or receiving medical care. The impact of social media, especially on younger folks, leads to worse health outcomes. What about medical care's impact on the health of populations? Despite what most people think, healthcare doesn't improve population health. In fact, medical care can cause considerable harm. Politics is the critical determinant of a society's health. People typically rank politics as being the least influential factor producing health. A focus on primary care improves health outcomes. The United States focuses on expensive specialty care. We try to fix problems rather than preventing them, spending almost $5 trillion a year, 1/6 of our economy, and close to half of the world's healthcare spending. Yet we're not healthy. Early life lasts a lifetime, namely the period in your mother's womb, ending around your 2nd birthday. Half of our adult health is programmed in that first 1,000 days. Healthier societies support that period with paid leave policies, free or low-cost child care, and minimizing poverty. American families lack the time and money required to parent effectively. Despite what most people believe, U.S. health is shamefully not good. Even if you consider yourself healthy today, this applies to you. There is a reason that the oldest living person at any given time is almost never in the USA. Our nation needs healing in a big way, the kind we would not typically consider, namely changing the political choices we make in order to live healthier lives. Make sure you like this video and subscribe. Join us as we further explore health in the United States.